This video has been developed by the North Carolina Division of Public Health in collaboration with state partners. The intent is to demonstrate one example of appropriate personal protective equipment, or PPE, recommended for use by those healthcare providers who will be providing direct intensive care for a suspected or confirmed Ebola virus disease patient in an Ebola isolation unit. This video will demonstrate one appropriate method for the sequence of putting on or donning and taking off or doffing of this PPE. You will see 3 healthcare workers in this video. 2 are working in the buddy system in the Ebola isolation unit, and 1 is a trained designated site monitor. This site monitor will guide the healthcare workers at each point using a checklist for every step to assure correct PPE use and adherence to the protocols. Before we get started, I would like to review a few key points. First, it is critical to move slowly and carefully throughout the donning and doffing process, in particular during the doffing phase. Doffing of PPE is a high-risk activity, so meticulous care should be taken so that you do not contaminate yourself. Multiple layers of safety are built into the process and must be strictly followed to provide maximum protection. Second, knowing these steps and effectively carrying them out are as essential to your safety as the equipment itself. Remember, this is a simulation, but designed to be as realistic as possible. The doffing area has been created to represent an anteroom, which can be a physical room or one created at the end of a hallway. There are 7 components of PPE described here. First is a gown or coverall. The second item is an apron. Third are gloves. Fourth, an N95 respirator. Fifth, a face shield. Sixth, a surgical hood. Finally, plastic boots or boot covers. Hi, Billy. Are you ready?
I am.
Excellent. Have you hydrated?
I have.
Very good. Now, if you would remove all of your personal items, this includes cell phone, pager, wedding ring, and place them on the table. The next step is actually to inspect all of your personal protective equipment that you have in front of you. Individual PPE materials should be inspected prior to donning. It should be verified that each recommended item is present without any visible breaches. The personal protective equipment shown here is based on that recommended by the Centers for Disease Control and Prevention. When donned correctly, this PPE is designed to eliminate physical gaps in coverage, namely, no skin or hair will be showing. The site monitor should wear a coverall, a full face shield, 2 pair of disposable gloves, and boot covers.
Okay.
Very good. Everything looks okay?
Everything looks good.
Excellent. All right, the next step is to wash your hands. Perform hand hygiene. Hand hygiene should be performed before PPE is donned. You will see that hand hygiene is repeated many times throughout the donning and doffing process. Next, put on your first pair of gloves, the inner pair. The inner gloves should be tucked under the sleeves of your gown or coverall, which is why they are donned first. Next, put on your gown or coverall. To begin, PPE should be worn over scrubs. Put on the gown or coverall. It should cover your entire torso and your arms to the end of your wrists. Fasten the gown in the back or zip up the coverall. It may be useful to add a longer zip tie to the zipper in order to easily find the zipper during doffing. If ties are present, tie in a simple knot or bow to ensure uncomplicated removal during the doffing process. Next, put on your plastic boots. If plastic boots are used, they should be reusable and worn under the coverall with the coverall legs pulled over the boot.
Okay.
Now, put on your N95 respirator. Healthcare workers wearing an N95 respirator should have previously been medically cleared and fit tested. The N95 should be placed over your face with the elastic band in the middle of the back of your head and neck. Perform a user seal check for the respirator, pressing all around the edges to assure a tight seal. Next, put on your surgical hood. This should be single-use, disposable. The hood should cover the hair, ears, and extend to your shoulders. Ensure your ears and neck are completely covered by the hood. All right. Next, put on your apron. This should be single-use, disposable, and impermeable or fluid resistant. Ensure the apron covers your full torso. If the apron ties in the back, tie in a simple knot or bow to facilitate safe and easy removal. Over here. All right. Next, put on your outer gloves. The outer gloves should be carefully placed on hands and pulled over your gown or coverall sleeves for overlapping coverage. Remember, outer gloves should have an extended cuff about 12 inches in length. Next, put on your face shield. The face shield should be put on over the hood. The shield should fully cover the front and sides of the face, including the skin and eyes. All right, now inspect PPE. No exposed skin or hair should be visible at the conclusion of the donning process. The healthcare worker should be comfortable and able to move freely while all areas of the body remain covered. And one final step is to perform hand hygiene on your gloved hands. Again, perform hand hygiene prior to entering the patient care area. Very good. Are you ready to provide patient care?
Yes.
First, while still in the patient care room, before entering the anteroom or PPE removal area, the healthcare worker must perform hand hygiene on the outer gloves. Remember that doffing of PPE is a high-risk activity. Do not rush. It is critical to move slowly and deliberately in the correct sequence to reduce the possibility of contamination. During the doffing process, the site monitor should remain in the clean section of the doffing area and maintain a distance of 3 feet away from the healthcare worker who is doffing PPE. If using the buddy system, inspect the PPE with your buddy and wipe down visibly contaminated PPE with an EPA-approved disinfectant wipe. If you did wipe contamination from your PPE, perform hand hygiene once again. Finally, ensure that the trained site monitor is present and engaged. Step into the chlorine bath upon exit of the patient care area.
Very good.
Next, step onto the absorbent walk-off mat.
Excellent. All right. Would you like to wash your hands? And now inspect your PPE for any visible sign of contamination. And if you find any, wipe it with a disinfectant cloth.
You and the trained PPE monitor should inspect the PPE for visible contamination or any breaches such as cuts or tears before removing the first piece of PPE. If you did wipe contamination from your PPE, perform hand hygiene once again.
So remove your outer gloves.
Remove outer gloves using the glove-in-glove technique. Using one hand, grasp the outside of the other glove near the wrist. Peel the glove inside out, holding the removed glove in the remaining gloved hand. Slide 1 or 2 fingers of the single gloved hand under the remaining outer glove. Peel the second outer glove off, rolling inside out.
Inspect inner gloves. Perform hand hygiene. And now remove your apron.
Remember, the outside of your apron is contaminated. Carefully untie any ties on the apron. Pull forward and away from the body to remove, rolling from the inside out.
Perform hand hygiene. Now inspect your PPE.
If you did wipe contamination from your PPE, perform hand hygiene once again.
Looks good. Now remove your coverall.
For coveralls, place one finger over your navel and follow the zipper up to unzip from the top. Grab the gown or coverall from the outside, pull away from your body and down, turning inside out as you pull. Avoid contact of the scrubs with the outer surface of the gown or coverall during removal, touching only the inside of the coverall or gown. Remember, the outside of your gown or coverall is contaminated, so move slowly.
Wash your hands. Remove your face shield.
Avoid touching the front surface of the face shield.
And wash your hands. Remove your surgical hood.
Lean forward, grab the top of the hood, and slowly pull the hood over your head and forward.
And perform hand hygiene.
Remember, your hood may be contaminated, so move slowly.
Now if you would inspect and disinfect your boots.
Use an EPA-approved disinfectant wipe to wipe down the boots now that the coverall has been removed.
And perform hand hygiene. Now if you would remove your gloves.
Remove the inner gloves using the glove and glove technique previously described.
Wash your hands. And put on a clean pair of gloves. Remove your N95 respirator.
Remove the N95 respirator by tilting the head slightly forward, grasping first the bottom strap, then the top strap, and remove without touching the front.
And now wash your hands. Remove that pair of gloves.
Remove inner gloves, again using the glove and glove technique.
And wash your hands once again. Let's perform one final check to make sure that everything looks good.
Perform a final inspection for any indication of a breach or contamination of the surgical scrubs.
You look good. And finally, have a seat and remove your boots.
While sitting down, slowly remove the boots. Be careful to keep the boots in the contaminated section of the doffing area, and once removed, put your feet in the clean area.
And perform hand hygiene one more time.
Put on shoes, change scrubs, and shower.
Scrubs and shower if so desired.
Healthcare personnel can leave the doffing area wearing dedicated, clean, washable footwear and scrubs. Finally, the healthcare worker should assure nutrition and hydration following the time spent in the Ebola isolation unit. In summary, doffing is a high-risk activity, so remove PPE slowly and carefully. Be meticulous about performing each step properly. Hand hygiene between each step is critical to minimize exposure to contaminated materials. Be vigilant, monitoring for any potential breaches which might result in an exposure. If a breach is identified, remove yourself from the patient care environment and notify the site monitor immediately. The recommendations provided here are based on the Centers for Disease Control and Prevention guidance for personal protective equipment dated October 20th, 2014. However, it is important to note that the North Carolina specific guidance does diverge slightly from those recommended by the CDC. Again, this video demonstrates one example of recommended PPE and one correct method for donning and doffing of PPE. We trust this video has been useful to you. We would like to thank our partners for their collaboration in the development of this video.